We're now at the beginning of the last week of April. Next week is going to be May. Wow. Seems like almost a lifetime ago, but in reality, well, it's actually been about 7 weeks since we started to stay home and practice physical distancing because of the coronavirus. Now, while the country appears to be flattening the curve a little, there are still large numbers of positive test results, including in our area. Dr. Janet DeMille, the medical officer of health with the Thunder Bay District Health Unit. Dr. DeMille, good morning.
Good morning, Lisa.
So the Lac des Îles mine, that was responsible for the largest cluster so far. What are the latest developments there?
So you're right, actually. That did account. I think it's up to about 25% of our cases are somehow associated with that outbreak on that mine site. We had about, and I think it was around 10 or 12 people that were directly were actually some mine workers, and then there's also sort of other people that they may have exposed sort of indirectly involved. And actually it's really exciting that today is the day that many people from that mine site who have been self-isolating will be released from that self-isolation. So if you remember, it was about 2 weeks ago. It was 2 weeks ago, actually, that one Monday where we worked very collaboratively with the mine management to help people come off the mine site and then to go back home or to a hotel in Thunder Bay, for example, to self-isolate for 14 days. And today is the day that will end. So that's a very, something we'd all been hoping for and waiting for. So if you see actually sort of mine workers in the coming days back in their communities, that's a good sign. And I must say I have to express my sincere appreciation to those workers for doing what they've done. It's been challenging for them, no doubt, and but they did the right thing, and that supported not only them but prevented them from potentially transmitting to their families when they got home and even into their communities. So I'm feeling very appreciative of the work that they've done.
Yeah, no kidding. I mean, this is all so new for everybody, right? I mean, doing the right thing is everybody wants to do it, but yeah, that's it.
Well, and I have to say, like, when I think of the mine, for example, this was just a really unfortunate situation, right? And nobody sort of, nobody wanted this. Nobody intentionally did this or knowingly, was part of sort of potential transmission at that site. So it's, it's really challenging. These sorts of things that can happen that we have to be able to respond to and learn from so that we can continue to work to sort of prevent these events from happening again.
Now, we heard from Chief Wilfred King of Gull Bay First Nation earlier this hour, and he says there are 7 confirmed cases of COVID-19 in his community of around 300. What can you tell us about that?
So, this is, just another example of where, you can get COVID-19 in a community, whether it's a mine site or Thunder Bay or a district community. But, certainly that's unfortunate that it did happen with Gull Bay. And what we're seeing, again, is the same sort of pattern, that there does tend to be spread, and it's often within sort of household or family members or people who are very close. And so being able to follow up, doing sort of the solid case, what we call case and contact management, to follow up and really try to contain it. And with respect to First Nations communities, it's First Nations and Inuit Health of Indigenous Services that does a lot of that support to First Nations communities. But we do work with them very closely. I have public health physician colleagues. There's public health nurses from FNI that are involved. And that is a bit of certainly a concerning situation with Gull Bay. And I'm sort of working collaboratively with them to be able to appropriately manage the situation.
I know you had testing again on the weekend, drive-through testing. How did that go?
So this weekend, very successful. I think we saw over 200 people this weekend, and it was drive-through as well as the community paramedicine program did go around to some people's houses as well. which is really great. It's so important to have these kind of testing opportunities. And we're in the process of analyzing the results from last weekend's testing. So we had, I think it was 250 to 300 people go through at that time. And I don't know the final numbers at the present time. And I think we've got in most of the results. And all I've heard is that they're negative. So I think, of course, I have to sort of analyze it. But everybody and I have to sort of double check to make sure we received all the results for every single person. But it really does paint a very reassuring picture of what's happening, especially at least in the Thunder Bay and surrounding areas. That and what I've said is the virus is here. It is circulating. We do know that people have caught the virus, likely in the community somewhere in their sort of interactions, but it's really happening at a low level. We've really held it at bay here. So it's really great to sort of see that. We absolutely, though, cannot let our guard down. All of our collective physical distancing has kept it at bay. But if we start letting up, it will just start increasing again. And so we have to be very mindful of that.
Yeah. Now, I know Premier Doug Ford last week says every person, every staff member, every patient in long-term care homes will get tested. What does that mean for you?
Well, it means a lot of work, but and certainly for the long-term care homes. I think it's part of the action plan for long-term care that the province announced, I think it was about a week and a half ago, which there were sort of three elements of that. And one was that sort of enhanced testing and surveillance. So being able to test to kind of get that baseline status, I think what's recognized in long-term care, especially in the residents, is that it can present very differently. So somebody can have even very mild or very atypical symptoms, and that could be missed if you're looking for a more typical presentation. And similarly with the staff, we've seen people with very mild illness, but that they can be then passing it on to people. So I think the broader approach with long-term care, which includes that enhanced testing, but also reinforcing or strengthening what we call IPAC measures, the infection prevention and control measures. This is something that we, as a health unit, we work a lot with long-term care at all times around IPAC and those measures and outbreak management. Whenever we have the winter season, there's outbreaks and things. So we're working with, we've increased our resources here at the health unit to be able to support this work. We're working with our colleagues at Public Health Ontario and at the Ministry of Long-Term Care, as well as with all the long-term care homes and retirement homes that we have in this area, to really review and strengthen those infection prevention control measures. And in addition, the government is also looking at the human resource aspects of it, because you really need staff to effectively manage, well, number one, on just a long-term care home in general, but especially when there's an outbreak, you need to be able to kind of manage things appropriately and have the necessary staff to be able to do that. So I think there's a lot moving forward, which I'm really happy to see. And we just have to kind of move through the planning stages and get into the implementation stages.
Stay safe, Dr. DeMille. Thank you so much for joining us this morning. Always great information.
Great. Thank you very much, Lisa.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.